It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi everyone, I'm Sam Lesante. Thanks for joining us. Folks, 2014, it's going to be fully implemented, and that's ObamaCare. And how does that affect you? Today, folks, we're going to learn about facts. Remember, I keep talking about facts. I'm very happy to have on my show retired surgeon and former Deputy Secretary of Health, Dr. Victor Greco, and of course, attorney Conrad Falvello, who is host of Law Talk. Gentlemen, thanks for coming on the show.
Our pleasure.
Thanks.
It's certainly nice to see you, Vic. I see him every other week on Law Talk, but it's nice to see you, and congratulations on that Unico Award. It was a nice honor.
Well, thank you very much. I appreciate that. Thank you.
The both of you have talked about, in fact, the current show that's running with Law Talk, Connie talks about the Obamacare thing. Let me start with you, Connie, first. Okay, 2014, I just said January. The Obamacare, if it's not repealed or if the Supreme Court, whatever the case may be, assuming everything is go, will be fully implemented. What do you mean by that?
Well, that means that when the law was passed 2 years ago, March of 2010, they structured it so that health insurers and those in the healthcare industry, hospitals, doctors, groups, would have an opportunity to, if you will, get ready for what they're implementing in January of 2014. And I think also part of that was that really, despite what Congress did, they anticipated there would be legal challenges. And the law does provide that even though the law isn't implemented now, it can be challenged in court, which it has been.
Now, there are certain things about the Obamacare. We discussed the commerce part. What specifically is that commerce?
First, let me talk, Sam, a little bit about what that is. It's called the Commerce Clause. And under our Constitution, the federal government has limited powers, and all other powers, governing powers, are divested to the states and the municipal governments. One of the areas that the federal government can regulate by law is interstate commerce. And that was the clause of the Constitution that the Democratic Congress in 2010, if you will, implemented to pass this law. They're saying that they made findings, in essence, that said the general health care industry and health insurance substantially affected interstate commerce. That is what is at issue in the courts now, whether that exceeded their authority to do that under the case law that has developed over the past couple hundred years.
Doctor, you 2 years ago we were talking about the Obamacare, and you had a lot to say about it. And I'm telling the viewers right now that I want to deal with facts here. I don't want to deal with whether we like a person, don't like it. I don't care whether it's a Democrat thing or a Republican thing. Let's just talk about the facts.
Right.
I got this leaflet in the mail from the Democrat National Committee. And it says here, President Obama signed a new health care law to put you and your doctor in control of your health care. He won't let anyone in Congress take that away from you. Okay? Now that sounds pretty good. He also says here, just when America's new health care law puts you and your doctor in charge of your health, some politicians want to take away your rights. All right? It's going to be higher cost. You're free preventive care. Lifetime caps can be placed on the amount of care. Women like you continue to be charged more. And it seems to me, when I read this, particularly this one here, 3 ways America's new health care law is helping you and your family. Okay, preventing discrimination against women like you, banning insurance caps on needed care, keeping your kids covered until age 26. My goodness, I want this. True or false?
It's a bunch of lies. It's strictly propaganda coming out of Democratic National Committee. There isn't a bit of truth in that. If anything, what's going to happen is that care is going to be rationed. Doctors will have very little, if any, say as to how to treat a patient. It'll be all run by committees out of the bureaucratic Washington telling us what treatments can be done, what we can do, what we can't do. And basically, this reminds me of the days of Hitler when the propaganda was spread all over the place, telling people how wonderful life was going to be. And the old thing, if you repeat a lie long enough, people think it's the truth. And this is exactly what's happening. It's just a political propaganda. The truth of the matter is, Obamacare, or call it any care you want, can only even begin to exist if they ration care. Because there's too many people who think they're going to get free care, and it's not going to be free. The taxes will be increased. What they're accustomed to and receiving now, as far as from their doctors, being seen, being treated, you're going to have a long wait time. Care will be rationed. End-of-life care is going to become a reality. They're talking about it more and more all the time, whereby once you reach a certain age, you will not be able to get certain procedures done, will not be able to get certain joints replaced, will not be able to have certain types of heart surgery. This is rationing care. They're also going so far as to deciding at a certain age there will be do not resuscitate orders on a chart, which means under no circumstances can anybody go in and give extra cardiac massage or try to bring a patient back. This is what we're faced. What they're doing, it reminds me, I think I mentioned this on the last show, those of us who remember the Pied Piper of Hamelin, is exactly who Obama is. He's playing the flute and the flocks are following him because he's making all kinds of promises. If I may, and I've never done this before, so I'm not blamed or said I'm stating falsehoods and not what the truth is. If this is what the American people want, this is what's going to happen. And I am now quoting the United Nations International Health Organization. This is not the AMA, it is not any political group, it's an independent group. They did a survey to show the percentage of men and women who survive cancer 5 years after diagnosis. In the United States, 65%. In England, 46%. In Canada, 42%. Percentage of patients diagnosed with diabetes received treatment within 6 months. United States, 93%. England, 15%. Canada.
Okay, just what he's comparing there is our free market system,
right,
to socialized medicine countries, England, Canada, correct?
That's correct.
Okay.
What I'm trying to do, and thank you, what I'm trying to do is point out that this is the care Americans are getting now. This is what they can expect under Obamacare. The percentage of seniors needing hip replacement who received it within 6 months, US 90%, England 15%, Canada 43%. Number of MRI scanners, which are used to make primary diagnosis, which is important. In the United States, there are 71 per million people. England has 14, Canada 8. Senior citizens, 65 plus with low income who say they're in excellent health, United States 12%, England 2%, Canada 6%. In Amsterdam, the average wait for, the average amount of time that a patient is seen in a primary care physician's office is 3 minutes. 3 minutes. Now, if this is the type of care that the American public want to give up to go into what I've just explained, then that's their choice. But I don't think that Obama and his cohorts should try to sell a bill of goods by overstating what they expect to want to give the people. A word of caution. Connie's read the bill, understands it well. You have, I have. In a typical political fashion, what they have done, they've given all the goodies up front, right now. And they're saying all this. Your child will be covered to a certain age. No pre-existing diagnosis keep you out of the insurance plan. Everybody's going to be covered. That's all the goodies. They don't talk about the cost. They don't talk about the price. If I may also quote some of the things that I found, if I have time.
Yes, you do.
That I found when reading the bill, and I read it. It's voluminous and it's crazy. But these are some of the things I was able to
Could you hold
extract.
that for 1
Yes,
second? Folks,
sure.
I'm talking to Dr. Victor Greco and attorney Conrad Falvello about Obamacare. I want to make a statement here, folks. This is not an anti-Obama or anti-Democrat. This is, no matter who the president or whoever proposed this, we're dealing with the facts about this particular Obamacare and how we may be misled, particularly you seniors who think this is a great thing. We'll be back right after this. Thanks for staying with us, folks. I'm Sam Lesante. Remember, 24/7, SSPTV.com. Millions of hits, folks, on our website. This show can be seen anywhere in the world. Just click on shows, The Sam Lesante Show. My guest, former Deputy Secretary of Health in the state of Pennsylvania, Dr. Victor Greco, retired surgeon, and attorney Conrad Falvello, host of Law Talk. Connie, you just mentioned something during the break. He was talking about rationing of care. Let's talk about your personal relationships in Spain.
Well, as you know, one of my brothers lives there, and one of his wife's relatives, they have socialized medicine. And I think it was his wife's aunt had a heart condition. She was in her 70s. They did not treat her. She had an uncle, mid-60s, late 60s. He was diagnosed with cancer, did not treat him. The presumptive reason is at that age, they're not a productive member of society, so it wasn't cost effective for the social system paid for by everybody, or the government in that case, paid for by the government to spend money to treat that person. Essentially, it is cost driven. I think that's one of the fears moving forward with this health care law, is that it will become more cost-driven in terms of the cost dictates the care versus the professional dictating or suggesting the care.
Well, Dr. Greco, you were going to give us a summary of what you said on the bill, and let's pick up where you were talking about.
Thank you, Sam. The reason I wanted to discuss this, because 2 years ago when you and I discussed this, a lot of people thought we were making up stories.
Yes.
And I had printed out some of the important things that we found in the bill. And if you remember when this bill was being discussed, the tremendous remark, brilliant, in quotes, that Nancy Pelosi made. Let's pass the bill and we'll find out what's in it. Because it was so voluminous, they had no idea what was in it, what they were voting on. These are just some of the things I was able to abstract. And by the page and line, I won't go through all that, but if anyone wants the information, I'll give them the exact page in the bill and the line in the bill from which it's taken. So all of these things are the absolute truth. There will be a government committee to decide what benefits and treatments you get, which is what Connie's already explained very well. It's known as rationing care. A doctor will have no say in it at all. He cannot continue to treat that patient, give that patient treatment under ObamaCare unless it's in the law. Your health care is rationed. The Health Choice Commission will choose your health care benefits for you. You have no choice. Health care will be provided to all non-U.S. citizens, illegal or otherwise. Now let that sink in. You know the problem we're having now with illegal immigration. I don't want to get into the immigration problem, but this is going to cost us just to treat the illegals billions of dollars, taxpayers' money, and we don't have it to even give care to the American citizen. The government will have real-time access to every individual's finances, and national health ID cards will be issued. They'll be able to go into your bank accounts, into your savings account, find out exactly how much money you have and exactly where what your finances are. The government will show that they'll have a database on your personal financial information. That means privacy is out the window. They will know everything they want to know about you. Government has the authority to disqualify Medicare Advantage plans, HMOs, etc., forcing you into a government plan. So even if you have private insurance, they have the authority to force you into a government plan. I can go on and on and on.
The question I have, Connie, for you, okay, you're an attorney who is extremely successful. You've built a reputation. You're no dummy by no means. And I'm not patronizing anybody here, but here's the facts. Don't we have lawyers who are in the Congress? Don't we have intelligent people that are in the Congress? To me, what Vic's reading and what we see here, the facts, would be like, why would anybody want to put us into that situation to eventually go into socialized medicine and ration our care? I mean, I'm like dumbfounded here.
Well, I think it really has that part of it, Sam, doesn't have anything to do with the law, okay? And in a sense...
No, but I'm talking about intelligent thinkers.
Well, but what I'm getting at is that it's political.
Absolutely.
Okay? More than legal. And in that sense, in my view anyway, it's a good thing that we have courts who can review whether Congress has overstepped their bounds, because if you have in one hand, what doctors talking about, the type of care or lack of care or cost of care that may come in January 2014. Personally, I think just as important an issue is how much control over our lives are we conceding to Congress here? And I think that is why it's been challenged, because what we talked about on our show is 2 out of 3 people in this country do not like this law. At least the polls that I've seen, they don't like it. And the primary reason they don't like it is because, for lack of a better description, the government is shoving something down their throat. The government is saying to you, Sam Lesante, if you do not buy health insurance, you're going to have, on your tax return, a shared responsibility payment. Now, that is a political phrase for you're going to be financially penalized. That's right. Okay? So they didn't call it a penalty. Now, when it was being argued in the courts, thankfully, recognize it as a penalty. It's part of the tax code, and if you don't buy health insurance, it comes out of your income. They're going to mandate employers to take it out of your income. But because they're saying, well, okay, you don't buy it, but you're still going to pay for everybody else's health care. So the mandate is important, and the challenge is before the Supreme Court now. And another big issue there, and I don't know if we have time to get into it, is what if the Supreme Court says the individual mandate oversteps congressional bounds and is unconstitutional? Does the rest of the law survive that declaration that it's unconstitutional? And there are any number of, there's a number of congressmen who have joined in the suit and say, no, if the mandate goes, the whole law must go, because everything else becomes essentially ineffective and unmanageable.
Do you think that this law should be repealed?
Personally, Sam, I don't like it, okay, for that reason. That's my individual opinion. But the reason that's before the Supreme Court, there have been, I think, 6 or 7 challenges in the district federal courts. Some have upheld it, some have not. So there is a division there on whether it's good law or not.
Do you think it should be repealed?
I think it should absolutely be repealed. In answer to a question you just asked Connie also, if I may get on it, as you know, when I was president of the Medical Society, I went before the legislators many, many times. And I have been active in politics, as you know, for a number of years. The reason the people in Washington voted for this bill, those that voted for it, is very simple. They want to remain in Washington. They want to be reelected. And so what they do is they give goodies out. They keep promising people all these gifts. Do you realize what an entitlement society we are today?
Yes, we are.
When you stop to think, and I'm quoting a figure now, between 57 to 59% of Americans do not pay tax. And yet if you look at what they get in a way of freebies, why should they be concerned? That's my concern, because if these people who are accustomed to getting a lot of things for nothing are going to go out and vote for the present administration, and we're going further down the road of socialism. And I'm reminded of that quote and the individual that came here from, I think it was Scotland, to see what American democracy was all about in the early 1800s. And when he went back and reported to his group of legislators, he said, the Americans have a tremendous form of democracy. He said, it's absolutely great. They're free. They can do what they'd like. He said, however, once the citizens realize that they can vote themselves benefits, he says, then it begins to crumble. And he said, I give it exactly 250 years before democracy, they know it is no longer there and it's strictly socialized. And he was pretty much on target.
That's an interesting observation.
Yeah, and let me just say this to you, Victor. On top of that, you know, you see, we have to punish you, Dr. Greco. We got to punish you because you worked hard to become a successful surgeon. You put tons of hours, sacrificed a lot of time from your family, and you became successful. Now I have to punish you because of your success. Same thing with you, Mr. Falvello. You worked all these to become an attorney, the troubling hours, but now you're wealthy. We hope, whatever wealthy is. And wealthy families already have good health care. So now we have to punish you people for doing that. And folks, what I'm trying to say is that you have to learn the facts. You think you're getting something for nothing. You think it's going to be a help to you. But these are facts we're talking about. They're scary. We'll be back right after this. Thanks for staying with us, folks. I'm Sam Lesante. Remember the official water of Sam Productions, SSP TV, Tonic and Mountain Spring Water. Obamacare, folks, good or bad? Attorney Conrad Falvello joins me along with former Deputy Secretary of Health and retired surgeon Dr. Victor Greco. So if the Supreme Court shoots this down in June, what happens?
Well, we're essentially with the system that we have now. And I think that the reason that it's been challenged is that the healthcare industry, be it the insurance companies, hospitals, physicians, right now they can't do any really strategic planning from a business standpoint. Admittedly, the government briefs before the Supreme Court, Chamber of Commerce brief before the Supreme Court, the ACLJ's brief before the Supreme Court. Every single one of them acknowledged that this, if it's implemented, would be a widespread and pervasive. Change is not a strong enough word. It would be a complete revamp of the healthcare system from the bottom up. I think Dr. Greco would agree to me. I mean, it's just, we'd be looking at, you know, the difference between a Cadillac and a Volkswagen. I mean, it's that much of a difference. So this is really critically important to everybody. I'm glad the Supreme Court has taken the case. I mean, they could hardly not take it. The decision is due, so I've read in June, perhaps August at the latest. Mm-hmm. So hopefully we'll have a little more information on that as time goes by. But it's, I think, Sam, one of the biggest legal decisions by the Supreme Court of my lifetime. So it's that important.
Dr. Greco, here again, the National Democrat National Committee with their flyers said, look, America's new health care law puts you and your doctor in control of your health, but some politicians want to take it away. Now, you're telling me just the opposite.
Absolutely. I'll repeat again, it's a big lie. It is totally propaganda. It's a political statement to try to garner votes. The truth of the matter is, if Obamacare is found legal, and one that goes into the fact your doctor will have absolutely no say in the treatment you receive. They'll be dictated to what we call cookbook medicine, and that is, this is the diagnosis, these are the tests you're allowed to order, this is the medicine you give, and this is the treatment you give. The doctor will have little or no say in varying from those things. We're going to have socialized medicine. We're going to have what they call managed care, but we're going to have ration care. Get that through your heads, everybody listening. It's ration care. How can you stop it? And this is not a political statement. This is a statement of fact. Study the individual's background who's running for office, House of Representatives, Senate, and President, and find out where they stand. And if they don't want to give you freedom of access to good medical treatment, and they're in favor of what's in that bill now in Obamacare, you don't vote them back. You vote in people who will take change, and yes, I'm for repeal of Obamacare. I'm not against universal health care if it's done properly. But as it is now, it's dictatorial, it's rationing, it is stopping end-of-life treatment and care. It's going to stop senior citizens, and this is important for you people in this area because most of us are senior citizens, you're going to be deprived of the care you need.
It looks like you compared this to Hitler. They come out and give you all the goodies. I remember they feed them sandwiches, get them all filled, and then once they say, "He's a great guy," then they clobbered you. Okay,
right.
That was your comparison.
Yes.
Okay, etc. So, telling the viewers out there to look at every individual, how they stand on this. They're going to lose their choice as far as health care is concerned. Is that correct?
That's correct.
Folks, to learn more about what we're talking about, Connie has the show Law Talk, and we have a whole show on that. I'd like to, at one particular time before the election, bring Dr. Greco back to reinforce facts. However, it's very simple. He got the facts. You Google, learn as much as you can. These are facts we're talking about. I don't know, when I get this, especially senior citizens, man, the doctors are going to take care of me and all these great things, and the women, are going to get all their, not going to discriminate women, and people are going to be covered up to 26. That sounds terrific. Is it really terrific, folks? Know the facts. Thanks for joining us. Remember, 247ssptv.com, anywhere in the world. I appreciate your comments on my website and also, my email, which is sam@ssptv.com. We'll see you next time.